It now is a distinct pleasure to introduce our longtime colleague on the GRC, Kate Walsh. Thanks for being with us this morning, Kate. There's probably no one in the city better positioned to help us see how the pandemic has hit the same vulnerable population and locations that climate change affects, and to discuss how we might begin to change things. Kate is the president and CEO of Boston Medical Center, Boston and New England's largest trauma center, and Safety Net Hospital. She is also chair of the GRC Healthcare Working Group. Kate, I want to thank you for all you are doing for our city on behalf of all the members of the GRC. Take it away.
Thank you, Amos. Good morning, everyone. Good morning, Amos, Secretary Kerry, and Chief Cook, who is representing Mayor Walsh, who I understand will join us a bit later. I'm always glad to be in this room in whatever form, even if we can only get together virtually. That's especially true at this difficult time for our city and for our entire planet. There are so many parallels between our experience with COVID-19 and the challenges of climate change. It's especially welcome and really gratifying to be with a group of leaders who prove that we can work together to tackle even the biggest problems. Together, we have already made significant progress on the challenge of climate change. The healthcare sector has been a leader in this work, and I'd like to take a minute to welcome my friend, Dr. Ann Klebanski, to her first Green Ribbon Commission meeting. She's had a very interesting start as a health system leader during a pandemic. And I want to thank Ann. Everyone in our state has benefited from your steady leadership and thoughtful leadership, and your commitment to furthering the GRC work will be critical to our ability to advance our agenda. I'm so proud to be part of our healthcare community that has cut greenhouse gas emissions by 1/3 in less than a decade, and I'm exceptionally proud that my own hospital, Boston Medical Center, is on track to become New England's first carbon neutral hospital by the end of this year. But as much progress as we've made, we know we have much more work to do. Our city is one of the nation's most climate vulnerable. And as CEO of the region's largest safety net hospital, I'm acutely aware of the disproportionate impact that climate change has on the communities we serve. At BMC, we see this every day, from kids with asthma in our emergency room to higher rates of cardiovascular disease and cancer. And we know that climate events have deeper adverse events of longer duration on the communities we serve. A moment ago, I mentioned the parallels between COVID-19 and climate change. There is a very specific link between air pollution and the impacts of COVID-19, and there is growing evidence that climate change actually multiplies the risk of pandemics, the two kind of feeding off each other in a vicious cycle. But overarching all of this is the outside impact that COVID-19 has in the same communities that are disproportionately affected by climate change. So I'd like to talk a minute for how that played out at BMC over the past several months, and most important, what we've learned and how we can leverage those lessons as a community to tackle climate change going forward. Faced with the impending tsunami of COVID-19 surge, hospitals like BMC ramped up to transform virtually overnight. Many of the reforms the health system has struggled to put in place for decades were put in place in days. Traditional public health tools like home visits, screening, tracing, telehealth, and contact tracing quickly became important and routine, as important and routine in our fight against COVID-19 as ventilators and IV pumps. Telehealth is perhaps the best example. Before COVID-19, roughly 4,000 people came to BMC for doctor's visits every day. In response to stay-at-home and social distancing guidelines, our hospital quickly cut the number of ambulatory visits by 90% and implemented telehealth visits instead. In doing this, we were really concerned that we would diminish access to care, especially for low-income patients. Instead, we found that by removing traditional barriers like travel time or finding childcare, we made care more accessible for our patients. The number of patients missing their appointment has dropped significantly, and we're able to schedule more frequent touch points for people who need them. It's also worth noting that telehealth is a lot better on the environment than driving or taking the bus to in-person visits. COVID-19 forced my own hospital and the entire health system to do things differently. The past several months have shown us that we can. Going back to business as usual is not an option. Instead, we need healthcare leaders from every sector to be as bold and innovative as the teams who sprang into action in the earliest days of this pandemic. With the surge largely past us, knock wood, we need to put that same energy into creating new models of care and a better healthcare system, an equitable system that works better for patients, especially for patients from disadvantaged communities. And this system has to cost less, allowing us to reinvest in the communities who will shoulder the worst fallout from COVID-19. The radical changes forced on us by this pandemic have taught us that a system focused on public health is not only possible, but necessary. And our climate crisis is the most fundamental public health challenge on our planet. As health system leaders, climate change is our responsibility. This is our lane. Just as we lost precious time preparing for the pandemic we knew was likely inevitable, we know with certainty that the impacts of climate change will be devastating unless we dramatically ramp up the speed and focus of our response. We're already hearing people suggesting that COVID-19 was a dress rehearsal for climate change. It's our obligation as leaders to rally to this challenge, to do everything we can to take bold action, to mitigate and minimize impacts before it's too late. The bottom line lesson from COVID-19 is when we come together, we can make sweeping change quickly. Our healthcare system has done it. Our businesses and institutions of higher education are developing innovative new ways to work, even as we speak. And I have no doubt that our biotech genius will be a game changer in the quest for treatments and vaccines. We can and we must bring that same spirit of multi-sector collaboration to the challenge of climate change. And that's what the Green Ribbon Commission is all about. This group empowers leaders across our region to join together to make changes we haven't previously dared to dream possible. I look forward to working with all of you. Thank you.
Thank you, Kate. A reminder to folks, please submit your questions for Kate through chat or raise your hands, but I will just kick this off with a couple of questions that came in over the course of the week for you. One is, you and Bob Biggio and others have done so much at BMC to take actions prior to this, in the run-up, well, we didn't know it was a run-up, but it turned out to be, to conserve energy and reconfigure your campus and take all kinds of sustainability-oriented and climate steps. So do you have any advice what specific actions we in other sectors might take to reduce greenhouse gas emissions that are consistent with public health?
So I think the most important thing, and if Bob were on this call, he would tell you, is look at your infrastructure install now. All of us think a lot about the assets we have to run our businesses. And for us, you know, hospitals tend to have lots of space and they tend to use lots of energy to power that space. 24/7, 365, the lights are on. People are here, they're doing work. They need to be able to find their way. People need to be able to sleep comfortably in the summer and in the winter. And so we spend a lot of money on energy. So how can you spend that money in service of reducing your greenhouse gas emissions? So it's really looking at the install you already have in place and making the changes that are that will move you in the right direction as an organization. And then any new space or renovation, one of the first dollar spent should be on hardening your infrastructure against the challenges of climate change and making sure that you can reduce your overall spend in this space. Because if you reduce your spend, you're likely reducing your greenhouse gas emissions along the way. There are some investments that you need to make, and you know, BMC as a safety net kind of struggled with the capital trade-offs in that arena. But you know, under Bob's guidance, he was able to prove that the financial payoff was there, in addition to our commitment to the health of our community. And you know, we take our role in this city very seriously, and really, as I said, this is our lane, this is our responsibility. These are the people we're here to make sure they get healthy and stay well, and resiliency and climate sustainability is a big part of that. It has to be hardwired into the work you do.
Thank you. We have time for, I think, one more question, and appropriately it is from Rebecca Hurst from UMass Boston. She runs the Sustainable Solutions Lab there. I would like to give her a shout out and congratulations for recently winning a major prize for her leadership there in her work with vulnerable populations. And that is her question: how are you preparing for hurricane season and heat wave season, since we're unable to respond to climate disasters in the way we usually do right now?
Yeah, no, thank you. That's a really good question, and it gives us a chance to talk about some of the work that we did, which was basically to create what's called an islanding facility. So on the roof of one of our buildings next to our farm is a cogeneration plant that allows BMC to basically go, if the grid goes completely out, we can make our own energy for a period of time. And of note, that facility also supports Boston EMS and the Boston Public Health Commission. So again, thinking about our responsibility as you can't solve climate in a silo. It has to be a broader set of solutions. So we were able to, through this construction, make this investment. We were able to also recoup some of that capital through some funds that we received from the state and the city of Boston for climate resiliency. So it really is thinking about everything. Katrina was such a catastrophe particularly for healthcare providers in that city, and they are still recovering from that in some parts of the Ninth Ward, and it was really our commitment to avoid that. So you saw the same thing with Hurricane Sandy. The location of where some of the equipment, the air handling equipment was what caused the evacuation of NYU Langone. So we were when we did our campus redesign, climate was a big piece of our thinking around it, and making sure that we had resiliency and redundancy, so that if a horrible thing happened, we could still serve our patients. Now, I've really jinxed myself twice saying the pandemic is coming to an end and there won't be a problem this summer, but I sincerely hope I'm correct.
We all sincerely hope you are correct, and we're all very grateful that you're there to take care of us if you're wrong. Thank you so much for joining us this morning, Kate. It is always a pleasure. And I am now going to turn things back over to Amos to introduce our next speaker,